Okay, hello again everybody. It's nice to be back. This is 7.5 weeks since my upper jaw surgery to correct the malloclusion class 3. And you may remember, if you've watched the other videos, that I had the upper jaw brought forward along with the cheekbones. So here we are, it's 6 weeks after our last little film, if you've been watching the films. So what can I tell you? I've got blocked sinuses at the moment, so it may sound as if I've got a cold, and it's gone through into this ear canal here. Now, I probably will post a note onto the video in a few days' time, because I'm going to see a nurse just to rule out that it's not wax in the ear. I'm pretty certain though that it's because of the swelling that I've still got round the middle of the face here, and the nose I still can't feel. But my bite is doing really well. I'm not having to wear any of the little elastic bands anymore. And I went to see my orthodontist last Monday, so that was a week ago, and she changed all the bands and put flexible bands on the brackets here, little pink things. So we're back, that the teeth are able to move again, and I believe that there's some back teeth that they want to move forward, and I'm told that we've got about 3 to 4 months to go on the braces, and then hopefully bingo, they're coming off. Been back a few times to see my surgeon, who is a great guy, and I'm really pleased with what he's done. But he tells me that if the swelling doesn't go down to his and my liking, then he will do something with my nose, which of course I've always been quite consistently worried about throughout this process. And as you can see, the nostrils have flared out quite a bit, and it's turned up quite a bit. Apparently this is a side effect with this particular operation. In 9 times out of 10 cases, I'm told, the nose will come back down to more or less how it was. In my case, we don't know, because he moved it forward quite a lot, whether this is going to be an eventuality. So the possibility that I may have to have a small operation on the nose to correct it. Oh dear, never mind. Anyway, I'd like to say that my time off that I had recovering from the operation, I spent a lot of time in bed. I didn't have much motivation to do much, although I had planned to do quite a lot of little things at home. But because of the painkillers and the anti-inflammatories, I wasn't able to focus properly on anything. So for the first month I didn't get anything really productive done. The day that I was meant to go back to work, I felt dreadful, and I ended up going to the doctor's, and she promptly signed me off for 1 more month. What I would say is that anybody who's sort of in the 40 to 50 year old age group who's going to have this operation, take it with just a pinch of salt. What the surgeon says, you need 3 weeks, 4 weeks off. I'd double that up if I were you, and if you can go back to work part-time in the 2nd month of recovery, then that is a brilliant bonus. But I'm now finding that having to cancel some of my clients because my diary's overloaded is a bit of a problem. So I would warn that, because I think you definitely do need time off, especially if you drive a car, because you don't want to be tired obviously at the steering wheel, and if you're on painkillers you are going to be feeling like that. What else can I say? Headaches have subsided. I'm off of painkillers now, still on anti-inflammatories, and I'm going to be giving you a side view now. That's the thing to do. So I'm going to go and look over here. How about that? And as you can see, everything now is in true alignment, which it wasn't before. So that's pretty good. And I'll give you a look at the other side. There we are. Again, a nice true alignment there. Okay, now how can I open my mouth? This is how big I can open it now. Okay, when we were recovering I could just about get a little finger in. I'm now getting near enough 2 fingers in. So that's a big improvement. I've not been doing any exercises. I'm told that this absolutely opens by itself, and that is happening. I'm a bit concerned about how my face looks because I'm not used to my face looking like this. It's a big shock when I look in the mirror. Obviously a lot of my friends are not recognising me, they think I look completely different. But this is part of the process of this big change, and I've got to grow with it. Obviously I've got to accept it in the mirror as it is, and each day it changes. So there we are. I think I've probably said enough now, so I'm going to be talking to you again in 6 weeks' time. So for now it's goodbye and God bless, and I'll see you in 6 weeks. Bye.